Can erasing acne scars erase your emotional scars? Let's find out. Subcision is a procedure where we take a long, blunt needle and introduce it under the skin and use that needle to essentially cut those little tethers that are holding your acne scars down. So it's like taking a little scissor and cutting off little buttons on a cushion. I promise it is not a treatment that hurts. You just don't have to watch it. When we do a subcision, you are basically removing that tethering, but your skin can come back down and adhere and reform those tethers, which is why a lot of times we combine subcisions with other things that can create an interference. So basically create a little layer below the skin that keeps those scars from re-tethering. I like to use a product called Sculptra, which is also called polylactic acid, which acts like a little fertilizer for collagen that is injected under the skin after we cut those tethers. Or you can also inject things like exosomes that will pretty much do the same thing as Sculptra. They will create collagen to basically create an interference between those acne scars and the tissue below. So you don't re-tether and have those deep scars again. Subcision actually works best when you combine it with other treatments. Usually we do subcision and immediately follow it with a treatment like microneedling with radio frequency, or even PicoSure laser. Subcision usually takes multiple sessions, and those sessions really range from 2 to even 6 sessions, depending on how deep the scarring is. But doing subcision alone is generally not recommended because it doesn't have such high yield. It is much better when it's combined with microneedling or lasers. Acne scars can be filled with fillers, but it is a very nuanced procedure. The type of filler being used, where you're not using a filler that's too soft to fill the scar or too hard where it can actually create a bump, is important. Also, usually if you are going to need to fill an acne scar, you likely are dealing with a scar that has to first be subsides. So doing a subcision and then going in and filling some stubborn areas with fillers is not a bad idea. But again, you also have to do it in combination with other things like skin resurfacing with treatments like microneedling or lasers. Subcision is safe for all skin tones because it's not introducing any heat or irritation, and which is something we worry about with darker skin tones. In fact, most people with darker skin tones, if they do have acne, tend to have deeper scars, and we commonly use subcision in them.